All right, you guys, in this video, we are going to be talking about draining and replacing an ostomy bag, providing ostomy care. So the first thing we would always do, obviously, is provide our AIDIT, introduce ourselves, verify the client identity, make sure they have no allergies, so on and so forth, and then we would go ahead and get started with our skill. First thing we always do is gather our supplies. For this, we really only need some paper towel to pad our patient dry. We are going to need a graduated cylinder to empty out the feces from the bag. We are going to need our stuff to apply our ostomy bag, which I will post a picture of in the video, and we can go ahead and get started. So the first thing we are going to do is make sure the patient is comfortable and let them know that we are going to be removing and doing everything that we are doing, and let them know that they can ask questions because we want them to understand this procedure, just in case they might have to do this on their own. So always encourage that the patient knows that they can ask questions. The first thing we're going to do is place a little barrier underneath, just in case there is some spillage. Once we have our barrier there, we would have the patient sit up. While they're laying down, we will not be able to completely take everything out of the bag. Then I obviously did place my gloves on, if you've seen already. Now that we have our patient in position, the barrier is there, our gloves are on, we'll take our graduated cylinder and we would place it right where the bag opens. There is a clamp right here that you need to open up. Each clamp is a little bit different. Ours, we just push in and then it should open right up. And you'll notice most of the time that the bag is folded up. That's just to prevent leaks. So we would unfold our bag. Usually there is some air in there. You would let the air out, and then you could go ahead and empty the bag into the graduated cylinder. So there's our stoma right there. We would obviously push everything out to the best of our ability into the bag. Then, while the cylinder is still there to prevent a mess, we would take our clamp, have it in position. We can go ahead and clamp this back up. We don't necessarily have to do this, but just to show you guys in case you were not removing, just fold the bag once, twice, and then go ahead and clamp it up. For our video, we will be removing this bag. So I'll clamp it and then I'll show you guys how to do that. Clamp. Make sure the clamp clicks all the way and it is in position so there is no leaks. Okay. Then, once we have our graduated cylinder filled, we would measure it, so for our documentation, and then we would dispose of this in the toilet only. After that, we can remove our gloves and perform hand hygiene and assist the patient in bed to a comfortable position. So that covers draining the bag. Now let's talk about removing the bag. So the patient does have a stoma right there, and if you notice right here, there is a cutout. And then around this cutout is a bunch of adhesive to ensure that there are no leaks. Now, the adhesive does not hurt necessarily when pulling it off, but sometimes if it's been on for a while, if there was some extra adhesives on, it could kind of pull on the skin. So what you would do is either take some normal saline or just a wet rag or something and just slowly peel this off. Just slowly, nice and easy. Pull the skin back while you're removing to promote patient comfort, and just get that bag right off. Now you have your wet rag, you're going to clean around the site, cleaning up everything, and then you would pat it dry. Once you have done that, you would assess the site, look around the site for any signs of infection or any stoma damage. Our site looks totally fine, so we would go ahead and start the process of applying the new bag. Alright, now that we have our old bag drained and removed, now we will start applying our new bag for our patient. The first thing we're going to do though is we are going to pat our area dry with some paper towel, which I have right here. I would go ahead and pat the area dry, clean off any of the old powder or any of the old adhesive that is on there. Then I would go ahead and assess my site. I would assess around the site and the stoma itself, looking for any signs of infection, any signs of leaking or anything of that sort. Now I will go ahead and assess my stoma site and look for the size that we are going to be cutting out. For that, we'll be using our measuring guide. I would go ahead and try out the different circles and see which ones fit. That one does not fit. It looks like the 1 centimeter does fit, or 25 millimeters. And then the 1/1/8 looks like it'll fit perfectly without irritating the patient. Because remember, if it's too close to the stoma, when they move or anything, it might scratch it or something that could irritate the patient. So we want to go just a little tiny bit bigger to prevent leaking, so you don't want to go too big, but also for patient comfortability. The next thing we're going to do is go ahead and take our bag and cut out the part that is going to stick to the patient. Some facilities have these parts separated, so you would have to stick this part first and then connect the bag. For our purposes, it is all one piece. So I've gone ahead and cut out our circle. You want to go, like I said, a little bit bigger to make sure that it doesn't irritate the patient. Then you can see right here, there's a little tab for the sticky adhesive. And then after that, we will take this white part off to make sure that it sticks perfectly fine, good seal, so there are no leaks, okay? So before I apply the bag though, if there was some redness, and even if there wasn't, sometimes for preventative action, we could add some stoma powder. We could also add some stoma adhesive. This is to make sure that the seal stays tight and does not break. Okay, now that I have gone ahead and applied everything to my patient, I will go ahead and stick my bag onto the stoma. So I've taken off the tape. This thing is very sticky, so try not to touch it with your gloves. We would go ahead and go around the stoma, make sure it connects with the skin perfectly, and we would press up against it. Remember, try to think of patient comfortability in this state. Don't press too much against the stoma, just the skin around it. And we are just making sure that that seal is created. Once these things start leaking, the seal will break, and then the adhesive starts to lose its stickiness, and then you will have to replace the whole bag. So this right here, your prep work is going to save you a lot of work in the future. So now it is covering the stoma, the seal is created. Now we need to make sure to go ahead and clamp our bag. Just like when we drained and removed the bag, it's the same thing. We're going to fold it once, twice, and then 3 times, and then we would go ahead and clamp. And make sure the clamp clicks so you know that you're ensuring that it will not leak. All right, now we will make sure that the patient is comfortable. We will remove our barrier that we placed to prevent leaking. And then we will ask the patient if they have any questions. If not, we will let them know that we will be checking on them frequently. And if there is any irritation or any uncomfortability around the stoma site, please let us know. And that concludes our skill.